6:48, and this morning we are wrapping up our week-long discussion on addiction. We are talking about alcohol and nicotine, two very popular addictions. This morning, Dr. Rosette Elgosain, a clinical psychologist, is joining us. You started the week with us. You're ending the week with us.
I am. Happy Friday.
Happy Friday. And talking about two very common addictions. There's about 3 million people with an alcohol addiction and 15% of Americans who smoke.
Yes.
Let's start with alcohol. How do you know, especially in a city like New Orleans, where most people drink a lot, that you're addicted to it?
So it starts out with maybe noticing that you're needing to drink alcohol to cope with something, so a stressful job. We see alcoholism a lot in attorneys and physicians. If you struggle to limit the amount that you're drinking or the frequency that you're drinking, even if you are trying to, that's a sign, or a warning sign at least. If you have symptoms of withdrawal, so tremors in the morning or irritability, depression, anxiety when you don't drink, and feeling like you need an eye-opener in the morning to kind of get your day started is a sign of that dependence.
Because you were telling me you actually would have some symptoms of withdrawal.
Yes.
If you wouldn't drink the alcohol in the
Absolutely.
morning.
So if your body is that dependent on it, if you cut that substance out, it throws off the balance that your body's in, and it can't regulate anymore without it.
Certainly. And of course, this is an issue, as we've talked about with addictions all week long, that impacts the family as well as those who actually have the addiction.
Yeah, we see relationships kind of getting severed and a lot of turmoil in families, divorce, just breakups happening. And with alcoholics, it's really hard to quit despite those consequences that are happening.
Certainly, and I know this one can be particularly difficult because they'll say, okay, you say I'm drinking too much, then fine, I'll just have 1 drink a day instead of 2 drinks a day.
Right.
It's a difficult one because a lot of people drink socially.
Yes. People drink socially, and that's fine, of course. And then, of course, we see different levels of severity with drinking problems. But alcoholism does take on, it's a different animal, really.
Gotcha.
Yeah.
All right, well, let's talk about smoking because, again, as we said, a lot of people struggle with this.
Yes.
How do you quit smoking?
So quitting smoking is actually incredibly difficult. So your body also becomes dependent on the relaxation and the stress reduction that nicotine can provide. And so what's addictive in cigarettes and dip isn't really the tobacco, it's the nicotine. And that's what gets you hooked on it, and it hits your brain, very, very quickly. So to quit it, it can take revising your coping strategies. So if you notice that you smoke to reduce stress, doing a lot of self-care, some meditation, increasing your exercise if you can do that, and then a lot of behavioral strategies. So doing something else with your hands, calling a friend, drinking a glass of water, and rewarding yourself for even the smallest steps.
Is the best way to quit smoking to just pick one day and say, I will never smoke again?
Yes, quit days are helpful for a lot of people. It really depends on your personality, but that's absolutely worth giving it a shot.
And nowadays there are patches and pills that claim to help people stop smoking.
Yeah.
Do you find that those things are helpful?
They're not my top recommendation.
Really?
They help
Why is
some
that?
people because you're still hooked on that nicotine and you're still needing more and more of it, and sometimes it's hard to learn how to function without it. So I would recommend a multi-pronged approach. So maybe try the patch, try the gum, but also do some of those other things.
Yeah, well, thank you so much for this conversation and for joining us with all this information this week. To get